Welcome back, everyone. Earlier this morning, I mentioned that our annual meeting looks a little different this year. One of our big goals is to hear directly from patients, tribes, and tribal partners, and we'll do that over the next hour. We want to hear your comments, concerns, and ideas about the patient experience, and we'll also take your compliments. The feedback about what we're doing well is also very helpful. Now let's welcome Zoe Merkuliev, Dr. Elizabeth Ortega, and Susan Brown. These ANTHC leaders will kick this session off with some brief updates on work we're doing to improve the patient experience, including facility improvements, access to specialty care and field clinics, patient travel and housing, and how to access patient experience resources. Following their updates, we will invite forward executive leaders that support these areas for a listening session and facilitate a live polling, priority setting exercise as time allows. The polling will be done on your cell phones, so if they're tucked away, please get them out so you can provide the feedback. Please keep track of your questions and comments as we kick off the introduction of these topics. I'm really proud of these ladies. They're tribal citizens and they're also leaders at the Alaska Native Medical Center. Our fellows, Zoe and Susan, are healthcare professionals with a lot of experience, but they're also our inaugural fellows for the Hospital Administrator Program. Our executive team, we were struggling, if you see on our scorecard in FY23, on our Native leadership measure. And many of our executives at ANMC have gone through a fellowship to be a hospital administrator, and that's how they got the experience in order to be hired in their leadership positions. So Dr. Vierling took that model and implemented it at ANMC. So Zoe and Susan are having that experience needed. So when positions come up at ANMC and across the Alaska Tribal Health System, leadership positions, their resume supports their application. So I'm really proud of this program, and I'm proud of Zoe and Susan for all the work they've done and their contributions to ANMC. So with that, Zoe, please get us started.
Thank you. Hello, my name is Zoe Merkuliev, and I am Inupiaq and Aleut, and my family comes from the communities of Kotzebue and St. Paul Island. As an administrative fellow, I've had the privilege of learning about the investments being made to improve services for Alaska Native people today, as we also plan for the future. ANTHC continues to make overdue investments as the board balances addressing immediate needs and achieving long-term financial goals. This includes transformational investments to improve patient experience, hospital capacity, and access to care. Many of us want to see an ANMC that is expanded to meet current and future needs, provides world-class care, brings care closer to home through effective field clinics, offers additional service lines when needed, and is flexible and meets the unique needs of the people we serve. When we better coordinate facility investments, steward limited funding, and enhance patient access to care, we also bolster and improve revenues. These resources are important. They all allow us to recruit providers that help us reach our vision to bring care closer to home through robust field clinics. Through the strategic plan, the ANTHC board approved $389 million in major capital investments. These investments address critical capacity constraints and improve access to care. The Emergency Services Expansion Project is already taking shape. We opened the Temporary Emergency Services Department in September, And next March, we plan to open 18 additional emergency rooms. Another 12 rooms will come online next June. Natasha will get into the details of this exciting project later today. Another major effort is building a short-term skilled nursing facility. The board approved this spring, and construction of that project is also underway. Foundation work is complete, and construction will continue through the winter. And we'll start hiring essential staff and plan for training to happen next summer, with a target open date in 2026. The end result will include an occupational and physical rehabilitation area, public and private dining areas, a chapel, game and activity rooms, and an outdoor courtyard. Bringing high-quality care closer to home for rural communities is a key organizational goal. Increasing the frequency of field clinics, improving telehealth, and exploring expanded partnerships are central to our long-term plans in this area. This work is central to ANTHC's commitment to improving community health, making specialized care accessible, and reducing logistical barriers patients face to accessing healthcare. Rather than measuring specific numbers of field clinics, we need to understand if we are offering the right clinics in the right places to meet the needs of each region. The primary goal is to reduce the strain of long-distance travel for patients by bringing specialized care closer to home, improving both access and timeliness of services. Here are some recent examples of our efforts to expand access to care closer to home. Orthopedic surgeons are now able to offer care directly at the TCC Surgery Center, reducing the need to travel to ANTHC. We're planning for general surgeons to provide preventative services such as colonoscopies at Maniluk and in other regions as opportunities allow increasing access to important preventative screenings. Some cancer patients are now accessing treatment via telehealth, depending on their specific care plan. This provides care at home and reduces the need for travel. Patients age 18 and older can access culturally responsive tele-behavioral health services through ANTHC's Behavioral Health Wellness Clinic. And at this time, I'll hand it off to Dr. Elizabeth Arteaga to highlight patient travel and housing efforts.
Thank you, Zoe. Good morning. I am proud to serve as the Vice President of Patient Logistics. My name is Dr. Elizabeth Arteaga, and my family comes from the YK Delta region of Alaska. Over the past year, we dedicated significant focus and resources to addressing the priorities identified by tribal leaders at the Travel Summit Series. The ANTHC Patient Logistics Division is committed to continuously improving our services based on valuable input from our partners and patients. Advisory councils occur monthly and provide a forum where patients and partners can engage and share feedback with travel and housing teams. These meetings are open to anyone. If you are interested in attending, please contact Ashley Kalan at amkalan@anthc.org. Soon, we hope to have an ANTHC liaison at the Ted Stevens International Airport. This new role will provide patient logistics support directly at the airport. One thing I want to make sure everyone has is the new patient housing hotline that you'll see on the screen. For any patient housing questions or help, please call us at 844-729-8430. The number is also on your screen. We launched this hotline to improve customer service. Our team can help guests traveling to Anchorage or who are already in Anchorage with lodging confirmation, change of medical escort, ground transportation services, and any general questions related to housing and travel. Guests staying in room on campus can reach the hotline by dialing extension 58430 from their in-room phone. The ANTHC Travel Management Office focused on 3 key improvements over the past year: travel coordination and advanced travel notice, system-wide standard communication, and modernization efforts. We are working with Specialty Clinic to ensure travel requests are submitted at least 14 days prior to the travel date. Efforts are ongoing to submit requests even further in advance when possible. The Travel Management Office worked with partners to define standard email subject lines, helping to bring attention to emergent cases needing immediate attention. We enhanced scripting for specialty clinics, helping to clarify who to contact for assistance with travel extensions. Travel packets are now updated with the most current processes and contacts. We will continue to revise the packets as needed to ensure transparency and modernize an outdated and manual system. The Travel Management Office is implementing a new software called Salesforce Voyager. Dr. Alan Vierling will have a more detailed update, but this system will essentially help us avoid redundancy and reduce delays in coordination and communication. In the meantime, we've adjusted some processes and workflows to ensure tribal partners are contacted to confirm travel requests received. ANTHC Housing recognizes the need for more comprehensive support and has initiated several enhancements in response to the feedback received from our tribal partners. A few key improvements over the past year in patient housing are check-in and check-out standardization, updating patient housing rules, and then streamlining the phone systems. A new digital queuing system is reducing wait times and streamlining the check-in process. As a result, guests are getting to rooms faster. For example, in September of this year, over 80% of our patients waited less than 30 minutes, and less than 1% waited more than an hour. We also implemented a check-in time of 4 p.m. and a noon checkout time to get guests into rooms more efficiently. To improve communication with guests at patient housing, we now have direct dial numbers on in-room phones that connect directly with housekeeping, front desk, and maintenance. We appreciate your continued partnership and support as we strive to do better. The relationship between the patient, caregiver, and healthcare team is crucial for the best possible outcomes. Treatment plans should always incorporate patient needs, values, and goals. Patient escorts are an important part of the Alaska Tribal Health System. They allow the patient to have a trusted family member or friend support them through their care journey. Key responsibilities of a patient escort include accompanying the patient to all appointments at ANMC or appointments off campus, maintaining daily contact with the patient and the hospital staff, and actively participating in the patient's care and education related to their treatment or procedure. Patient escorts must follow all rules of patient housing and ANMC facilities during the entire stay, including being drug, alcohol, and tobacco-free. There's still work to be done regarding escorts, as it is a particularly complex topic, but we remain open to feedback and innovative ideas on how to better include escorts in patients' care plan. I'd now like to welcome Susan Brown to highlight a few patient navigation and experience updates.
Thank you. Good morning. My name is Susan Brown. I'm the Administrative Fellow for ANTHC. My family comes from 3 tribes, the Inupiaq of Little Diomede and of Unalakleet, and the Athabascans of the Holy Cross area. As an Administration Fellow, I have seen how our healthcare system works for the health and well-being of our people. And I've had the opportunity to sit at the table where decisions are made. Our mission and vision are the most profound purpose we could ask for. It fills the cup of many here today. It is our why. Your healing and recovery is important to us, but does not solely fall on providers or caregivers, As a patient, you have rights and responsibilities to support your healing and recovery. A full list of rights and responsibilities could be found at our website at anmc.org. A few important ones to highlight are maintaining a safe and quiet environment for healing yourself and others, partnering with your providers to create your health plan, and respecting staff, patients, and visitors' right to privacy. A patient escort may be approved, and they can help you with your care plan and communicating with your providers. Patient feedback is the cornerstone of how we evaluate our impact and assess how well we are doing in day-to-day operations. There are several ways to share your concerns or let us know when we did something well. While our website at anmc.org provides up-to-date contact information for patient experience, we have 3 representatives here today. Please stand as I call your name. Don Black, Brett Olson, Ida Noonkesser. If you have any comments or feedback, they are available for the remainder of the day to speak with you. Koyana Puck, I'd like to hand it off to Natasha.
Thank you so much. I'm so proud of these Native leaders at ANMC. Dr. Arteaga was just promoted to the Vice President of Patient Logistics, and we're seeing a lot of improvement under her leadership. So I'm really proud to work alongside these healthcare professionals. I'd like to invite a few more people to the stage. Dr. Alan Vierling, ANMC Administrator. Dr. Chris Matthews, ANMC Operating Officer, not a doctor, but. Jason Hart, Director of Medical and Multi-Specialty Clinics. Hazel Graham, Director of Patient Housing. As leaders make their way up, I'll take a moment to share some of the feedback I've heard while visiting communities around the state. I've heard a lot of the appreciation for the focused work to make widespread improvements. That's proven in the measures the board scores us on each quarter, but I've also heard a lot about the ways we need to improve. I want to share a few stories that stand out. I recently heard about a patient who was in a fragile health condition. They just received a diagnosis that week. And unexpectedly, they were asked to stay on campus to receive care at the hospital. And they were forced to change rooms every single day of their stay. We want to ensure that people are not burdened like this in the future, that they have a place to rest when they don't feel well and when they have just received difficult news about their health. I've also heard concerns about patients not knowing or expecting where they could stay as part of their visit. Our goal is to provide consistent expectations and supportive care, which is why we're evaluating how to expand patient housing resources. I've heard about opportunities to ensure warm handoffs are happening between case managers at the hospital and case managers in home regions. Our goal is to ensure a seamless transition of care happens when patients return home. During this time, our priority is to listen. We have asked that our executive leaders be present to hear your firsthand experiences to inform our improvement efforts. We will answer questions as we receive them, but we will also hope you take us up on the opportunity simply to be heard. Now, I just saw a few of our interior tribal leaders walk in, and they're very used to this like patient feedback hour. That's a lot of times how we hear our opportunities for improvement and take that back to our planning. But I know this hour is making some who are not used to that a little nervous. So I just ask that when we deliver our comments and questions, we respect the leaders here upstage, and I know that we will. We're going to start by hearing everyone from the poll. So take out your cell phones because that's how you're able to provide that feedback. And if you need help with this poll, raise your hand and we have staff around the room. So to ensure we capture the widest variety of feedback and priorities from everyone, we have created polls for everyone to engage in real time. So whether you're in person or online, you can participate. The poll can be joined either by a text or online. In your folder, there's a reminder for instructions how to participate. If you want to use your phone, open a new text message and text ANTHC to 22333. Again, 22333. You will receive a confirmation that you have joined the poll. The numbers or letters will appear on screen that you use to send via this same text message to submit answers to the poll. And then for open-ended questions, you will simply type and send your responses in the same text message. In your web browser, open a web browser on your phone, computer, or tablet and go to poll, E as in elephant, V as in val.com/ANTHC. Your feedback will be archived and used to inform our ongoing work. I think the poll has already started. I'm way behind. Responses will be anonymous unless stated otherwise and will be shown here on the screen. So the first poll question is, how would you rate the level of service we provide when it comes to managing appointments? I see a lot of needs improvement, which we're expecting. We agree. We do need improvement. It's really great to see, though, that there's over 30% that think we're good or excellent. So that's encouraging to hear. Again, if you want to text, it's 22333. 2 2s and 3 3s. I don't know if that helps. And maybe the staff could just tell me when they think we've captured enough of the polls. Okay, well, we know that we expected this, that we need to improve. I think, a lot of the good and excellent is great to hear. Unacceptable at 5%, we don't ignore that. Okay, they're telling me to move on to the second question. Thank you. When you arrive on campus, how confident are you to get where you need to go? A is very confident. I know my way around. B is somewhat confident. I know who to ask even if I don't know. And C is not confident. I don't know where to start. When you arrive on campus, how confident are you to get where you need to go? I just got a text just yesterday from a friend traveling into Anchorage who said she felt like a country mouse on campus. But she received excellent care at the HCB. Thank you for the feedback. Somewhat confident and very confident. Not confident is 13%. We need to ensure that our patients know where to go, or at least where to ask where to go, so we'll be working on this. Next question, please. If you have stayed at patient housing in the past year, the hotel located on campus, connected to ANTHC by the Sky Bridge, how would you rate your overall experience? The patient housing right on campus that connects to the hospital by the Sky Bridge. A for excellent, B for good, C needs improvement, D unacceptable, or E does not apply. Unfortunately, we can't fit all of our traveling patients in on campus, which ideally we want to get there. So some will needs not apply. That's a very large amount, 44%. We know that many of our patients are off campus.
For those of you texting from your phone, once you get into that text by sending ANTHC to 22333, you will see the letter representing the answer on the screen. So if you want your answer to be reflective of A, excellent, text A, hit send, and it will live add to our polling here. Thank you.
Okay, so 40% does not apply because so many of our patients either live in Anchorage or were housed elsewhere. We need to work on the 6% unacceptable, but we expect needs improvement, and it's good to hear 11%, over 30% are good and excellent. That's great to hear. Thank you for the improvements over the past few years. Next question, please. If you have stayed at patient housing in this past year, how would you rate the check-in process? This is one that we've really been working on. Well, 3 years ago, it was terrible, 4 hours wait line, really decreased that check-in wait times. If you've stayed at patient housing in this past year, how would you rate the check-in process? A for excellent, B for good, C needs improvement, D unacceptable. Or maybe does not apply. Maybe it's probably a good thing if you haven't had to come in to travel for your health care. Next question, please. You all are getting quick at this. How would you rate your experience when seeking an appointment at ANTHC? A, I get appointments when I need it. B, I sometimes experience delay getting scheduled. Or C, I cannot get appointments when I need it. We're not able to see the answers live, but we are capturing the answers secretively. Just kidding. Oh, we have 70 responses. That's great. We're going to get a lot of great information today. Okay, is that it for our polling questions? Polled questions? Oh, they're fixing it. Okay. I will also contribute to the poll. What I learned during this planning process of the annual meeting is we actually have a patient feedback meeting each month that Dr. Arteaga has initiated. I did not know that, so that's great to hear. We're not just getting patient feedback from our board meetings or when we go out to the communities and regional THOs, we're actually getting it facilitated by our leader here every month. It's good to know. Okay, how would you rate your experience when seeking an appointment? I get appointments when I need it, 37%. That's a surprise to me. That's really good to hear. Sometimes I experience delays about 40, and then I cannot get appointments when I need it, 22%. That's a large percentage of people who can't get appointments when they need it, and that's something that we'll work on. There's a few more coming in. Okay, they're saying go to the next question. Thank you for your patience with us on that one. Do you know what it takes to have a patient escort approved and what their responsibilities are to support a patient? We heard the responsibilities earlier. There are a lot of responsibility. A very serious position as a patient escort. Many know how to get approved, and what the responsibilities are. That's great to hear. We had a travel summit the past few years, and patient escorts were one of the main topics, trying to make it easier for escorts to travel with patients. Of course, we experienced Medicaid hurdles with that. Also, just some of the logistical issues with housing our escorts. Those who are bringing children with them can cause challenges. So really good discussions at the travel summit, where your regional tribal health organizations and your tribes really come together and try to create solutions as a system. Thank you. Next question, please. How would you be most comfortable providing feedback if there was an issue with the care you received? A, in person with a team member from ANTHC. B, in writing before I leave the hospital. C, in writing through a follow-up survey after I get home. Or D, over the phone. Capturing your feedback is so important to really our planning, everything, how we implement our measures. This team right here in front of you is committed to taking that feedback and implementing the change necessary. We also have a survey that Alan will talk about this afternoon. We really would like more patients participating in it. Very important. So this question we will use to see how we'll obtain your feedback in the future. Okay, next question, please. Rank. What is most important as a patient to feel supported in my care? Length of time spent with the provider, written information about the health conditions you are experiencing, availability of an appointment within 30 days, multiple appointments during one visit to campus, and quicker access to provider via telehealth. Those are really hard to rank, right? So many of those are, very important to the care you receive as a patient.
For those texting in on this, this one is available for the online. It doesn't allow for the texting from the phone, so this is the only question that is limited to that.
Online only, I'm hearing. I like the multiple appointments during one visit to campus. It's such a burden for our rural residents to have to travel into Anchorage. They get a babysitter, take time off of work, miss your subsistence season, have to keep a warm fire in your house, whatever it is, and then to have to turn around and do that all over again when you could have just had all those appointments in a week. Okay, thank you for your feedback online. Sorry for the texters who weren't able to participate. Okay, next question. Please share with us how you feel that your cultural values are respected during your care or appointment. And this is just an open-ended question that you could share a few words with us. Please share how you feel that your cultural values are respected during your care or appointment.
For those on your phones, you can text that. So you can text your full statement via your phone and it will show up live. Thank you.
Okay, so this isn't an open-ended question, it's a poll. Okay, providers are often excited. Oh, it's open-ended. confidentiality is so important for our patients. It's a small community, so many of us know each other, and ensuring that their care is confidential is respecting our cultural values. Thank you. Someone said it's not. I think it's important to learn more of why it's not. We have such a diverse cultures in Alaska, diverse peoples. To me, I want to be told straightforward, be direct, tell me how it is. That's how we are where I'm from, but that's not how it is in our diverse cultures everywhere. So it's important that once we teach and really train our providers and staff about the diverse cultures, we're going to get to a point at ANMC and across the ANTHC that we know when a patient enters, what culture they're coming from and what people. So thank you. We'll move on to the next question.
Natasha, for those of you that would like to talk with our patient experience team, just a reminder, they are here in the room. Brent, if you could give a hand raise, and I'm going to let you introduce yourselves.
My name is Brent Olson. I'm the supervisor of patient experience.
My name is Ida Noonkester. I'm patient experience.
Great to see you all here, our patient experience staff. We want to hear directly from you. Or if you had someone from your community who had an issue, feel free to bring forward those issues as well. We're not going to use names, but just in general, how we could have improved care. When you visit campus, what reminds you of your home or your region? This is an open-ended question. I went to the sleep clinic for my son, and there was all these awesome pictures from all across the state, and I was able to identify a picture from Shagluk because I've traveled out there a few times, and it wasn't labeled, but sure enough, I got it right with Shagluk, so I felt like I won bingo. What reminds you of your home region? I like the pictures. All the artwork. We're lucky to have the artwork at ANMC. We actually don't own that artwork. It's donated for display by another nonprofit, but it's so gorgeous. The food reminds you of the home region. I agree. Sometimes we get some of our native foods. I've seen a lot of fish bellies for breakfast. That's so good. But then sometimes it's not so much, but we're improving. Oh, the native dances in the ANMC lobby. That's really nice. I see one of our dancers here in the audience that I regularly see there. Okay, we're good to go, they said. We've captured enough of the feedback. Next question. Are there amenities that would make your stay on campus more comfortable and conducive to healing? A, more common areas to spend time with family while waiting for care. B, group activities. C, updated space for cultural activities. D, a place to watch movies. E, access to a gymnasium and workout facility. F, indoor play area for kids. We're undergoing our master site facilities planning, and we're probably in the second half wrapping up that planning. But we do understand our patients, need something to do while staying in Anchorage. And we're trying to think about what's the best thing for our patients. I personally like a gym, but not everybody who's sick can utilize a gym. So that might not be realistic. common areas to spend time is getting a lot of remarks. See a gym, we're basketball people. I try to tell Alan that. Okay, next question, please. Do you know how to contact ANTHC when receiving emergency care outside of Alaska Tribal Health System? Is it the anthc.org? Or yes, head nod. I got one right. I would call the patient housing hotline. I'm starting to give that out to all our patients. I was given Dr. Arteaga's personal cell phone number, but she gave me the proper number to give out. This is an important one because you don't want to be stuck with a bill when you're traveling outside, right? I know at TCC, when you're traveling out, you need to contact TCC ahead of time. So other regions might have PRC rules, purchase and referred care rules you really need to look at. Okay.
Natasha?
Yes.
We also have Solveig Johnson here in the room. She is our PRC director, and we also have a PRC table. Solveig is the most excited to share all of that information with you at her table. It is an amazing conversation to have with Solveig. She will get you all the details that you need so that you can make sure that your care is covered when you have emergency care services.
I don't want to leave this question up without providing the answer. So anthc.org, it is the proper place. Or if you call in ANTHC, ask for purchase and referred care. Okay, I got that right. Solveig Johnson is the purchase and referred care director. Next question, please. What form of contact is most convenient for you to notify our team? A, a phone, B, a text, C, an email, D, a fax, E, online form, F, smoke signal. Oh. We might as well put fax in a smoke signal. Oh no, there's 2% who like fax, so we'll keep that as an option. I know TCC still use typewriters, so. Oh, Jacqueline said they retired them. Maybe that's one of the measures you successfully retired the typewriter. What form of contact is most convenient for you to notify our team? I know the young people don't do the phone calls. They only like texts, so. Maybe we have an older crowd today. I'm smooth. I'm really going to get this job. What form of contact is most convenient for you to notify our team? Okay, we'll move on. They're saying, don't quit talking. If you have stayed at patient housing previously, would you rather stay in patient housing next time? A, B, stay in an off-site hotel, or C, does not apply? As long as there's a roof over your head. Thank you, Peter. We are trying to do our best to provide like a standard quality for patient housing, whether you're on campus, at Spring Hill Suites, or like in the community. We're doing our best to do that. stay in patient housing next time. Only 24%. That surprised me because of the convenience of the location, but the other hotels do have pools, so I do like to swim. Does not apply, 27%. Okay, that was the last question for the online poll. Thank you all for participating. That's going to provide great information for this team as we move forward. Now we're going to allow for questions from the audience and online. If you're online, please submit any comments or questions in the chat, and they will be shared with us here.
We are ready with an online question.
Okay.
All right, so why do I have to move hotels after I'm already here and have checked into my room?
Thank you. The question is, why do I have to move hotels when I'm already here and checked in? Hazel, do you want to take that one?
Yes, I'll definitely take that one. Hello? I'll definitely take that question. Sometimes when people have reservations, they're booked into certain locations, and when a patient is extended, there may not be inventory at the location they're currently at, or potentially, if they're offsite at a hotel, they may not have availability for us to purchase or extend their stay there. So unfortunately, we would have to move them to an available location.
Thank you for that question. We hear it across the state. It's a challenge that we want to get away from. We're looking at housing options to address this issue. We don't want to have this as a common issue going forward. Any other questions, Amber, online? I'm not seeing any hands raised yet. We have Peter Williams from ANTHC raising his hand.
Yeah, I just want to say I would encourage TCC to have patient housing by their consortium. The reason why I said that is because us village people are coming to Fairbanks having a hard time with destination on our rides. And that van that rides around with TCC, they put you into a hotel like Seven Gable. They got no access around there, so we need some encouragement on having housing, patient housing by TCC. Chief Andrew would really appreciate that. Thank you.
Thank you so much. Across the state, our regional tribal health organizations and tribes are challenged with patient housing issues when whether they're coming in to a sub-regional clinic, whether they're coming into a regional hub, or here to Anchorage at ANMC. We're experiencing the challenge across the state. One opportunity is the 105L program that allows us to, it's a kind of a newer opportunity in the past 5 to 7 years where we receive facility funds, and these have been covered for patient housing. We didn't have that before, so it's opening up a lot of opportunity. But Jacqueline is here with TCC, and she heard your remarks, so thank you.
We have a question from online. Why do I have to wait over 3 weeks for a necessary MRI?
Okay, that's a great question. 3-week wait for a necessary MRI.
I can take that one. Again, my name is Jason Hart, Director of Multi-Specialty Clinics. So, historically, unfortunately, we have provided a lot of unnecessary MRIs for patients. Sometimes it's to appease the patient. And, in essence, we have moved to more clinical guidelines that allow us to ensure that the patients are medically necessary. And in order for us to ensure that that's happening, we have to schedule out a couple of weeks. So.
Thank you.
We have a question in the room.
Good morning, everyone. I'm from the UP de Vandrefsky in St. Mary's, and a lot of times when patients have appointments here in Anchorage and their flight gets canceled due to weather or some other issue. Is it quicker for them? I mean, do they call to their appointment where they're going to make a quicker reschedule? Because I've heard some of the people say that when they call here in Anchorage at the hospital and let them know their flight is canceled, their updated appointment is scheduled quicker rather than going through the regional hospital. It takes a longer time, and I'm thinking it's probably because of the communication that has to be done between the hospital here and like the hospital in Bethel. So I was just wondering like what advice to give to patients whose appointments have to be rescheduled due to weather or travel.
Thank you for the question. So I want to make sure I get this right. When patients get their appointments canceled due to weather, historically they've gone back into the queue, and it makes it a real challenge. And so what we've attempted to do and what we're working on and what we would prefer, if a patient gets canceled for whatever reason, we want them to keep coming to Anchorage. We want to work them into the clinic. So we just had literally this week a patient who was coming out of the Aleutians who missed their colonoscopy due to weather. We worked with Jason and we worked with the surgical team, and that they came to Anchorage anyway, and they're getting their colonoscopy tomorrow. So our goal is weather is not a detriment and creating a delay in care. You're gonna, as soon as you can get here, we will fit you in. We're gonna work with you to get seen as quick as we can. We think it's a real problem, especially think about the cancer patients and others. You know, I shouldn't have to go back into a queue to wait 6 weeks or 2 months or whatever for the next appointment. We want people to keep coming. I recently sent out a letter to all this executive team saying, this is our goal. If a patient's canceled because of weather, keep bringing them to Anchorage. We'll figure this out. Our job is to take care of the patients. It's not to be deterred by the weather. And so that's our approach.
Can I just add to that a little bit, Ellen? So I would say if clinic staff for some reason are giving you a different answer, make sure you reach out to our patient experience team and they'll connect with me and others, and we'll make sure that you get what you need.
So follow-up question to that is, if the patient is traveling on hospital pay or Medicaid, then that has to be reapproved through the travel agency or whoever is issuing the travel request. So that takes time. So they can just go ahead and come in once their travel has been approved, because I know a lot of people travel on Medicaid and or patient travel, and that those appointments have to be there prior to approval for travel.
That's very accurate, as you know. So our goal is to go ahead and get the patient here. So if we need to work through the travel office, we'll work through the clinics, and we'll give an appointment date for as soon as we can get the patient here. You know, this is a new thing for us. We've been working at the edges of this for about a year, trying to make these details come to fruition. We'll work with Medicaid. Again, we would rather see you here than not. And quite frankly, the hotel is not a detriment to this at all. It is the flight. The flight is more of a challenge that we have to work with Medicaid with. But we'll take that on and we'll keep working that. We have a Medicaid committee that works with Medicaid on a frequent basis to work through these types of issues. So this is one that's on our radar screen and one that we're going to work through, because Medicaid, I don't think they feel any differently than we do that patients deserve and need care, and weather should not be the detriment. So we just need to have a continued effort towards that. And as we've committed to do this, I think we're going to get there. And this will be one of the bigger things that we accomplish and make happen.
We have time for 2 more questions. So we have a question in the room, and then we have a question online.
Hi, my name is Albert Green. I'm out of a native village of Hooper Bay. So it's kind of a similar question. So my 7-year-old son needed to come for dental surgery. So I called Bethel and say, hey, I have a storm coming. Can you send me to Anchorage a day early? I said, I have family that I can stay with. You don't need to worry about that, but just put me and my son on a day early. And the group in Bethel told us, no, we can't. And she said, how do you know the plane's not going to make it? I said, I'm from here. We know when storm's coming and plane's not going to make it. And she still said, no, now we have to wait another 2 more months for the surgery.
Thank you for the question. Rather than answer specific questions, because those get really difficult because of all the circumstance, if you don't mind, we'll follow up with you right after this, get a little bit more detail, and then we'll work back to it. We've got great partners at SCF that help us with the dental surgery, and that's in their element of support. So let's work with you outside of here. We'll come back. We'll work through that dynamic, but we really do want to make that work for everybody.
And what I'm hearing is we also need to coordinate these weather issues better with our tribal health organization and tribal partners so that they're working off the same information that we are. So thank you for the question. There was a few more hands, Amber, in the audience.
I'm going to go to the question online, and then I think we'll take 2 more questions in the room. We will go to door prizes. Lunch is served, but you're not limited to your time here with this question and answer time. We have brought our team here to be able to assist you and answer questions, and they will be available. And Dr. Veerling, I do have a patient that has a direct question for you afterwards, so please find me. Okay, from online. Earlier in your presentation, I saw that you are opening a short-term facility. Have you ever thought about opening a long-term facility, assisted living home? If you do open one, are you willing to transfer those who are out of Alaska to come back home to be closer with their family?
Thank you for that question. Yes, it is in our plan to do a short-term skilled nursing facility. Right now in the hospital, we have a throughput problem. At any day, we have 20 to 40 patients that are well enough to be discharged, but not well enough to be at home. And so that facility was really built to take care of those patients. In Alaska, we don't have enough of these skilled nursing facilities, whether they're short-term or long-term. If we doubled the amount of facilities, we'd still be in 50th place for these facilities. It's really an issue, and we all need to be talking to our lawmakers, whether they're in Juneau or DC, about the lack of skilled nursing facilities in Alaska. I'm going to turn it over to Alan to answer the question directly about, is it in our long-term plans to have another skilled nursing facility that we're actually able to take patients not just from ANMC, but from other locations and even outside of Alaska?
Thank you very much. So the reality is not, as Tasha said, we don't have enough skilled nursing facility beds in the entire state. It is a real detriment, and it creates hazards for our patients, and frankly, it's not the ideal level of care. So the board has a strategic plan, and we need to work with the board on that. But the reality is there will have to be additional beds for skilled nursing created in association with the campus at some point in time. Our plan is to finish up the first phase of this, which is the skilled nursing facility directly on campus, and alleviate the challenge that we have with patient flow in the hospitals, because it's also an issue when we can't get people out, we can't get people in, and so they stay in the villages when we think they should come a lot quicker. So we need to finish that part up. However, as that is happening, we are engaging in the dialogue around what would another opportunity for us look like. And so we need to figure that part out. We've got an idea. The answer to the question is yes, but we've not worked with the board yet on what the plan would be, and we've not proposed to the board, this is what we would do. And there's many board members sitting here, I'm sure they're quite supportive of the idea, but the reality is we need to have a plan, and we don't have a plan, and we don't have funding, and we don't have all these steps yet. So as we get those things detailed and worked out, but I would say that we're at least a year away from having that next evolution of discussion.
Thank you. For those who have asked questions online, if you could also please leave your contact information in the chat so that we can follow up with you on the additional questions. And now we have Chief Leo.
Yeah, good morning. Chief Leo from Kaikook, former chief, but still a chief. Anyway, we just had a meeting for Tanna Chief Sub-Region from the Yukon Kaikook recently with you all on our, on all our water and sewer problems that were going out through in that region. I was wondering, where is that at right now? The biggest question that comes to mind is that our horrendous electrical bill that we've been getting, and we're still getting it. I was wondering if you've come to any kind of conclusion on that yet, because I haven't heard anything back from anybody since that meeting. Thank you.
Thank you, Chief Leo. We just had a debrief last week on the meeting we had with 6 interior tribes on our water and sanitation projects. It was a great meeting that really drew out a lot of those challenges we talked about this morning. And when Chief Leo, we were able to share with the audience online and here in the room a lot of those challenges. We have a timeline with Tanana Chiefs Conference and the Interior Regional Housing Authority to work out the memorandum of understanding that we promised. Our timeline for that is for the end of the year. Specifically on those utility costs, I'm gonna ask David Beveridge to follow up with you right now. I think he's in the room next door. He's probably listening to me specifically on that issue from Kaikook. So thank you.
We have a question here.
Hello, Malia Kibak from Arctic Slope region. And this is for patient housing. When the patients check into the patient housing, they examine their beds and they find bed bugs, and they check out of there to go to the hotel. Have you guys resolved that?
Thank you so much. Bed bugs is an issue across the nation and the state, and it impacts facilities here in Anchorage. We have implemented checks specifically on bed bugs, and from what I hear, we haven't had a case in a very long time, but I'll have Chris, who wants to answer the bed bug question directly?
I can answer. So to dispel any myth, bed bugs travel to anybody. When I lived in Houston, I had bed bugs in my home because it just got introduced. There's a negative stigma that comes with it, but it's just the reality of where we live. And so at patient housing, we heat treat. We have specific chemicals that we can spray. They do get introduced at times. We have not had an infestation, we don't. And as identified, we help support individuals that may need to have their belongings and items treated if it comes and is introduced into the environment. So as it happens, we are happy to work with people. We do know that there's a negative stigma. We know that it's also very difficult, but we want to help as we find it, though we have not had any infestations on our campus.
Thank you for that question. I agree. There's a negative stigma to bed bugs, but it's just part of the human existence. One of my families, I won't say the village because you'll know which household, but my family this summer had bed bugs, and they were so embarrassed they didn't even tell me. But I'm so proud they reached out to ANTHC actually, and ANTHC got them everything they needed to address it right away. And so it's just something that happens, and I'm glad our staff is just so open to just addressing it. Did we have another question? Oh, they're saying no more questions directly? Is that accurate? Okay, we have lunch, and so these fine individuals are here to answer your follow-up questions. We have patient experience, purchase and referred care. We have our health fair in the lobby. Vaccines are available, and so please continue asking the questions during the lunch hour. So thank you for being up here and trusting me to take on this hour. Even though we have a lot of improvement, you all are doing such a great job of bringing forward our board and patient priorities. Okay, now the